A visit by the Citi News team to the Tema Manhean Polyclinic in the Tema metropolis has uncovered the deplorable state of the health center. This report, filed by Citi News' Rachel Engman and read by Wilma Obobisa-Coleman, gives more insight into the situation.
The Tema Manhean Polyclinic was established as a health post during Dr. Kofi Abrefa-Busia's administration in the 1970s. This polyclinic, operating under the Ministry of Health, serves as the sole healthcare facility for the densely populated town of Tema Manhean. Sections of the facility, including the outpatients department (OPD) and various offices, suffer from leakages whenever it rains. Additionally, Citi News observed damaged louver blades, torn nets, loose roofing sheets, exposed electrical cables, and noticeable cracks on the walls throughout the premises. The OPD appeared makeshift with overcrowded wards and no designated workspaces for staff. The on-site ambulance had also broken down, necessitating the use of the constituency ambulance during emergency. An undisclosed source stressed that the relevant authorities were aware of the challenges, citing financial constraints as the cause of the renovation delay. In reaction to the findings, the Tema Metropolitan Chief Executive, Johan Ama Ashite, disclosed that measures are being put in place to raise funds to address the issue.
The only problem that we face is that due to limited funds available, it makes it a little bit difficult for us to be able to fix the issue. And if you look at the problem, it's not a problem that you could face in phases. You have to lift the entire roof and replace the entire roof. So it makes it difficult for you to start the job when you don't have all the funds available. So yes, I'm aware of this. I've been there a couple of times, and then the last time I went there with the engineers, we were able to come up with the estimates to fix the roofing issue. And that is a problem. But there is something that we are planning to do. We are actually planning to engage and involve some of the industries that we have here. When I took over, I did something that I called Mayor's Ball, and I invited almost all the industries in Tema to the ball. Some of them were able to support in some areas, but I think where we don't have much support coming is health. So now this is what we are going to do, and it's not because of this. We already have a meeting with them in about 2 weeks' time. And what we are going to do is that we're actually collating all the materials that we need, because sometimes if we want them to bring in physical cash, it doesn't come. But if you can supply us with the roofing sheet, with the wood and all that, we believe strongly that when we invite them and then we make it a little bit more detailed, even if you don't have funds to give, we believe they can supply us with the roofing sheet and then the wood and everything that we need to do the job. And when that is done, then we can arrange for our own manpower. We can get the issue fixed. Yes, they have an issue with the ambulance, but you see, Tema East, we have a new ambulance station at Committee 4. So anytime there's a problem, quickly, the ambulance is deployed. The one there is an old one. You know, one ambulance per each constituency. So those ones are there. Anytime anybody has a problem, quickly, the ambulance is available. It deploys faster. What they have is an old one, which is a rickety one. And to replace it, you must buy a new ambulance. But we all know that we don't have funds available now to do so.
Meanwhile, hospital authorities refrained from providing comments over the development when Citi News reached out to them.